Golfer's elbow, or medial epicondylitis, is characterized by inflammation of the tendons inside the elbow. Repetitive motions like gripping or swinging can lead to pain, radiating into the forearm and wrist. Symptoms include tenderness, weakness, and stiffness. Treatment often involves rest, ice, and physical therapy, while severe cases may require surgery. Consult a healthcare professional for accurate diagnosis and tailored care to relieve discomfort. Golfer's elbow, also known as medial epicondylitis, is a painful condition affecting the tendons on the inside of your elbow. While the name suggests it's exclusive to golfers, it can affect anyone who repeatedly uses their wrist or clenches their fingers. Here's a breakdown. Understanding golfer's elbow. What it is. It involves inflammation or micro tears in the tendons that connect your forearm muscles to the bony bump on the inside of your elbow, medial epicondyle. These tendons control the muscles that allow you to bend your wrist and clench your fingers. Causes. Repetitive wrist and finger motions such as those involved in golfing, racket sports, weightlifting, throwing sports, gripping tools, computer use. Any activity that puts repeated stress on the forearm muscles. Symptoms. Pain and tenderness on the inside of the elbow. Pain that may radiate down the forearm to the wrist. Weakness in the hand and wrist. Stiffness in the elbow. Pain when making a fist or gripping objects. Numbness or tingling that radiates into the fingers. Treatment. Non-surgical. Rest, avoiding activities that aggravate the pain. Ice, applying ice packs to the elbow. Pain relievers. Over-the-counter or prescription medications. Physical therapy. Exercises to strengthen and stretch the forearm muscles. Bracing, wearing an elbow strap or brace. Corticosteroid injections. Surgical. Surgery is rarely needed, but it may be an option in severe cases that don't respond to other treatments. Key differences from tennis elbow. Tennis elbow affects the tendons on the outside of the elbow, while golfer's elbow affects the tendons on the inside. It's important to consult a healthcare professional for accurate diagnosis and appropriate treatment.